Hey, it's Dr. DeCubellis here. Today, I want to talk about some of the biggest misconceptions and problems with low back pain, and even neck pain. First biggest problem is that people think it comes out of nowhere. That is 100% not true. You have pain for a reason, and that's your body's way of telling you that there's a problem. So let's talk about some of the problems that happen when people experience pain. Number one is waiting too long. You have an issue, you put it off, you wait too long, and then by that time when you get it looked at, now it's become something severe. Whenever you're experiencing pain, it's always best to get it checked out rather than waiting, because now you're taking something that's very, very acute and may be able to be fixed very quickly, maybe in a couple of days. But the longer you wait, the more injured you become, the more compensation your body does, and the more potential new injuries you have as well. Also, now we're leaving time for arthritis degeneration to set in. So you never want to wait. You get it checked out as soon as possible. The next issue is covering up the symptoms or just treating the symptoms. If you have pain, the reason you have pain is not because you lack Tylenol or aspirin or ibuprofen in your body. The reason you have pain is that's your body way of telling you that something is not working properly. It's putting pressure on nerve fibers, and you need to get this checked out. So what you're doing by covering the symptoms is, yes, you're giving yourself some pain relief, but the problem is just there. So what your body has to do then is it has to shout louder. It has to yell louder. It has to try to get your attention more. So now the pain has to get worse, or the pain is going to spread because we have another body part that's been overworked, and now we have a new injury that's set in because we were covering the symptoms instead of looking at what the underlying issue was. Number three, the next problem we have with this, actually going to be finding out what actually is the problem. Because here's the thing, sometimes when you have pain in, let's say, your hip or your lower back, it doesn't always mean that that's where the problem is. The problem could be somewhere else. So we have to make sure we're looking and finding exactly what the issue is. If you don't know what the problem is, you can't get it corrected. What are you doing treatment-wise? You don't know if you're making it better or worse. You're just wasting time. So we want to make sure we're actually getting to the underlying issue. Sometimes the way that you experience pain is because your body's compensating for an issue and you're overutilizing certain body parts, muscles, tendons, and ligaments because they're trying to work to take pressure off of an area that's in a completely different spot. So you might have pain where the overcompensation is, but they're overcompensating because of a problem somewhere else. So that's why it's very important to get everything looked at so that way we make sure we don't miss anything. The next problem I see people do is that they try to avoid movement. Let me be very clear though. Avoiding any movement is what we're talking about, because if something is painful, you don't want to keep doing it. If it's painful to walk, do we just say, okay, well, I'm just not going to walk, or I'm only going to walk a little bit, or I'm going to walk with a limp, or I'm going to walk with crutches? Or if it's painful when I bend my knee, I just won't bend my knee or I'm wear a brace. Now, these things, when we start taking away different things that we're doing, they're not actually doing anything to get to the underlying cause or make anything better. What you're actually doing is you're forcing your body to compensate even more to try to take away or not get you in those painful situations. The problem's still there though. So we don't want to be avoiding movement. We want to find ways to actually be able to move that way with less and less pain, so that we train our body to not only heal, but not change our movement patterns. I see this, people start moving differently. They train their body to move a new way. Now the problem heals, and now they're moving completely different, causing more problems. And now they are down this vicious snowball effect. They start having issues start forming in different joints, everywhere above and below where the original problem is. So the goal is not to avoid movement, is to take it slow and avoid some of the painful movements, but try to get back to them as soon as we're able to. All in all, if you're having pain, you make sure you get it looked at as soon as possible, because trying to just cover the symptoms or avoid movement or trying to just wait, give it time to heal on itself, if it's been more than a week and it hasn't healed, it's not going to. So you get it looked at, because the sooner you get it looked at, the sooner you can start feeling better. And we don't allow time for things to start getting worse where we have arthritis and degeneration set in, which means our ceiling of healing is going to be severely limited.